Hi there. Welcome to The Good Doc. I'm Dean Karampolis. I'm a critical care physician. I practice in Gainesville, Georgia, at a busy teaching institution. We are members of arguably the most difficult of all professions. As healthcare providers, we face difficult situations on a daily basis, often with little guidance or empathy. In fact, I've been practicing for 40 years and still my mother has really no conception of what I do. This YouTube channel is designed to offer practical and common sense advice to members of the medical profession and to enable you to be better at what you do and to have a more fulfilling career. In the course of time, we will cover a multitude of subjects commonly encountered in outpatient and inpatient practice. These topics are designed for medical students, residents, APPs, and attending physicians, but anyone in the medical profession should also benefit. We'll be covering a diversity of topics such as how to choose the right area of practice, how to establish and maintain a good reputation, recognizing and dealing with burnout, the physician and his wallet, social interactions in the workplace, and how to deal with failure. I have already assembled a large list of subjects that you can see here. For today, though, I'm going to discuss the enormous challenges that COVID-19 brings to our practices and how we can deal with them. But first, let me just share a few words about myself. I graduated from medical school in 1979, and I'm board certified in internal medicine, pulmonary medicine, critical care, and sleep medicine. I'm also a licensed Georgia attorney and have a master's in healthcare administration. I have been involved in administration, medical directorships, and hospital committees. I've had my own private practice, and I've been a hospital employee. Currently, I work at Northeast Georgia Medical Center as a critical care physician in a teaching institution. I also have a number of hobbies. I'm an instrument-rated pilot. I love to compose music on the piano and guitar, and I love to sail. In fact, if you can make out anything in this background, you could probably see my recording equipment and my flight simulator. I've been married for 42 years, and yes, to the same woman, and I have 2 children and 4 grandchildren. I've had a lot of successes in my career, but I have made mistakes. And my hope is to be able to give you the benefit of my experience to make your lives easier and to make you the good doc. As we go through some of these rather serious topics, I will try to inject some humor, and I hope that it's good enough so that you can actually recognize that I'm doing it. I also await your comments and suggestions to improve my YouTube channel. I also have a website, a membership site that can be viewed for free. It will include regular postings and blogs and many additional topics that are more thoroughly covered than here. So far I have no content posted, but feel free to look at the site and offer comments or suggestions regarding its structure and format. The URL is thegooddoc.net. Now let's talk about COVID-19 and how it's changed our profession. Before I get started, though, I want to emphasize that we're not going to discuss or even entertain questions or topics of a political nature in this talk and in future talks. I'm very interested in it, but I do not want to get embroiled in a controversy. So please do not post comments that express political issues. I would really appreciate it. So what is so different about COVID-19? Well, the one thing is the sheer volume of patients that we have with this disease, and also the death rate once admitted to the hospital, especially the ICU. There's also lack of efficacy of therapies, lack of standardization, changing recommendations, limited information about the virus itself, and the uniqueness of the virus, the scarcity of resources, including healthcare providers. We have restricted visitation, which leads to angry and distrustful families. This really adds to our stress level and to our workload. As an older critical care and pulmonary physician, I practiced during the beginning of the AIDS epidemic. I faced the threat of Ebola, and like you, I have seen many seasonal influenza deaths. The thing that's different now, though, is that during these COVID-19 spikes, many hospitals are literally filled to the brim with very sick and unstable COVID victims, sometimes comprising the majority of critical care and non-critical care beds. Many hospitals, such as ours, have opened up dedicated ICU and non-ICU beds to handle the volume. By the time a COVID patient becomes ill enough to require ICU care or mechanical ventilation, there is a very high mortality rate, no matter what you do. We're constantly exposed to patient death and to gloom, and established treatments come and go like a revolving door, to the frustration of the family and physician members. Family members depend upon what they read in the internet or what well-meaning relatives tell them. Often this information is unbalanced and out of context. As healthcare professionals, we know that some of our patients will die, but those who practice in the hospital setting, we've never seen deaths of this magnitude. We feel at the same time sad and angry and frustrated and helpless. Some of us are confronted with our own mortality, and many of us feel like failures because our patients are dying. This leads us to question our own abilities, and worse, when many of us thought this was a short-lived epidemic, we've discovered the contrary. So I want to give you some words of advice that have helped me. First, take care of yourself. It looks like this COVID is going to be with us for a while, and we need to realize we may be in for the long haul. Therefore, treat this thing like a marathon rather than a sprint. Don't, in general, blame yourself for patient deaths. Of course, if you screw up, that's a whole different story. But it is easy to feel like a failure, even if you've done all the right things, especially to us who are high achievers, accustomed to success. After all, we're facing a deadly disease against which there are few therapies that are effective once a patient becomes very ill. Another important thing is to recognize symptoms of burnout. Often this is noticed first by others, such as your spouse, before we're aware of it. Typical symptoms we know include fatigue, insomnia, overeating, undereating, lack of sex drive, lack of motivation, depression, anxiety, and panic attacks that come out of nowhere. But also recognize that anger, impatience, argumentativeness, and being too judgmental may be early signals. For myself, I have a lot of trouble going from the ICU to regular life because things are so fast-paced in the ICU and things in regular life are much slower, and I get impatient. If you are experiencing burnout, it's important that at least you find somebody that you trust that you can talk to, that you find a way to slow down, and that you receive professional help if needed. Another important thing is to be willing to say no to additional work that's offered to you. It may be difficult because you see others working extra, you may feel guilty about it, and you may need the money. But remember, we're in this for the long haul. On your time off, spend as much time as possible with your family and friends. Of course, exercise and get plenty of sleep. And try to relax on your days off. Do something for yourself, something fun. And it's important that you pursue non-medical outside interests, which I have done all my life. It's very important to recognize that what you do actually makes a difference. Patients and families are in a very frustrated and vulnerable situation. You are in a direct position to comfort them and to alleviate suffering, even if your patient dies. One thing that's kind of counterintuitive, but I think could be quite helpful, is to have a servant's mentality. Serve others, not only the patients, but fellow hospital and office workers and people outside the office. Take some time to ask people how they're doing and be a good listener. When we serve others, we take the focus off ourselves. For example, you might try to do one thing per day for someone else other than your patient without expecting anything in return. Also, it's very important to be grateful for what you have. After all, we have a job, we're not sick, and we've achieved enormous success in our lives. Especially when you look at the tragedy around you, you can realize that we are truly blessed. Now for this next part, I want to talk about families and how I deal with them. One unique thing about COVID-19 is that family visits to the hospital are severely restricted. In some cases, a hospitalized COVID patient may not be allowed visitors at all, or only for the purposes of discussing goals of care. This has played an enormous impact on our ability to deal with families and take care of patients. and has imposed quite a bit of time constraints on us. This is ironic because family contact is extremely important for the mental health of our patients. It has been shown to improve patient outcomes and length of stay. Realize that family members feel helpless because they cannot visit their loved ones. They may also feel guilty for commissions or omissions in the past. It's possible that they could have been instrumental in convincing the patient not to take the vaccine. Also, family members are confused about what therapies are effective and why a previously accepted treatment is no longer valid. They see mixed messages and distrust the system. They may even suspect that the hospital physician is not prescribing a drug because it's too expensive. And it's common for well-meaning friends and family members and relatives to give advice to people that is incorrect or out of context. And then information gleaned from the internet is often inaccurate and out of context. Family members are justifiably confused. They've seen many inconsistencies regarding public health policies, causing them to distrust the government and healthcare agencies. People in general are good at picking up hypocrisies and find them very distasteful when people who advocate mask wearing, for example, they don't do it themselves. As a result, we will find and have found that our family members are frustrated and angry. They may even blame us for visitation policies of which we have no control. Dealing with these angry and demanding family members significantly adds to our workload when we're already working at maximum capacity. This also affects goals of care discussions. They're quite difficult. They've always been difficult, but more so now. It's hard to convince a family member that their previously healthy loved one is going to die. COVID-19 is such a new disease that many family members have had trouble judging its impact, as opposed to established diseases such as cancer, where they have a feeling for what impending death is. And the inability to visit their loved ones adds to the uncertainty when making a DNR decision. So here's my general advice on how to handle families. Realize that we're in nearly unprecedented circumstances, and understand that patients are angry and confused and probably have a right to be. Recognize that in general, that the family members are not attacking you personally. Of course, they may. And make it a point to call up family contacts on a daily basis. It's better to diffuse their anger and frustration on a daily basis rather than to deal with an intense outbreak of rage. Oftentimes when I speak to families, I have nothing new to tell them, and I keep answering the same questions. But these conversations signal to the family members that I do care and that I'm doing the best that I can. It's really, really important to give a consistent message to family members. They hear things, conflicting information from all kinds of sources in the hospital. Try to correct misinformation before it gets out of hand, and misinformation that they received outside of the hospital. When or if you are verbally attacked by a family member, never retaliate no matter how much you want to. It never works. It never helps. Just take the hit and forget about it. Talking to your peers after the incident can be therapeutic, but don't unleash anger upon a patient. Also, it is paramount to never criticize healthcare workers in the presence of others, especially the patients or their families. Also, never blame a family member for discouraging your patient from having taken the vaccine. They are already probably dealing with a huge amount of guilt, and there's nothing to be gained by it. If you're blessed to have a palliative care service in your hospital, it would be great. It's good to involve them in the family conversations. It helps you in terms of your workload, and I think it gives better communication to the families. I hinted on this before, but try not to be so judgmental against those who have not taken vaccine because they feel that the vaccine is not safe or because they think that they've been misled by the government. Anyone who listens to the news realizes the public has received mixed messages. Families can sense when you're being judgmental. I'm not saying that you shouldn't discuss the vaccine with family members. It's okay to question them about their vaccine status if it's done with the correct motives. And I am speaking as one who's actually had COVID-19 and had been vaccinated. So to close, I want to read a letter that I wrote to fellow healthcare providers at the height of the epidemic in 2020. As you recall, back then there was no vaccine and a lack of PPE. Many providers had considerable fear that they would contract the disease. So here is my letter. As healthcare providers during this global pandemic, we have been worked to the bone with inadequate protective equipment, constantly confronting our own mortality, and plagued with the guilt that we may be the major contact for transmission of the disease to our loved ones. While others are complaining of psychological trauma due to self-quarantine, to no eat in restaurants, to no gym workouts, and to the difficulty of spending extra time with their children, we have been facing a real threat and an uncertain future. We receive little recognition for our sacrifice, and most likely our efforts will be quickly forgotten after the pandemic has abated. The patients that we save will most likely never thank us and will quickly disappear from our sight. Our loved ones are suffering, seeing us exhausted and fearing for our safety. The bottom line is this: we have been called to a noble profession. We make the difference in people's lives on a regular basis. We are doing something that is meaningful. The definition of love has been distorted in today's society. It is not what we see in Hollywood. It is placing the needs of other people above ours. Love is action that benefits others, not merely emotion. Love is frequently what is done in secret without recognition or praise. Healthcare providers are an unusual breed. We want to help others. It is a privilege to be allowed to minister to the weak and to the frail. Whether we are physicians, APPs, nurses, RTs, X-ray technicians, or custodians. I believe that this crisis will draw healthcare professionals closer together, create a lasting bond among us, and teach us to separate the important from the unimportant. It will bring out the best and the worst in us. It will also reveal our true character. So why do we do these things? Why are we working like this? It doesn't seem to make sense. We do not expect to benefit materially or to receive the recognition or praise that we deserve. We do this because we are called. We want to serve others. We are noble and we care. We just do it. The future of the coronavirus pandemic is unclear, but we will be the better for it because noble character is perfected through adversity. This pandemic will draw us closer together and teach us what is really important in our lives. In the future, it will hopefully instruct us not to waste our time and effort pursuing the unimportant, rather to devote our lives to things that make a difference. I appreciate you listening to this message. There are going to be many more of them on my YouTube channel. Please respond to this message with any criticisms or questions or any suggestions. If you've benefited from this, I also encourage you to subscribe and to visit my website, which is listed below, thegooddoc.net. And remember that we're all in this together. Thank you very much for your time.